Depression is a common mental disorder affecting children, adolescents, adults, and the elderly. The degrees of suffering and disability associated with depression are comparable to those of the most chronic diseases and are also associated with serious long-term morbidities and a risk of suicide. There is now growing evidence to support screening for depression among children, adolescents, and adults. Unlike screening in clinical settings, when screening for depression in general populations or a community sample, the physical and mental comorbidities are unknown, and the lack of such information might lead to an underestimation of the depression prevalence generated from studies that screen the general population, as depression is associated with exacerbating prognosis and treatment outcomes of patients with comorbid conditions. There are no studies attempting to investigate the feasibility of using smartphone apps for depression screening or monitoring, and there is no data concerning who will be willing to download and use these apps if available. This study aims to examine the feasibility of Apple app stores for the promotion of depression screening in general populations, determining users' characteristics, and identify the prevalence of participants with higher risk of depression that seek this depression screening app, while accounting for physical and mental comorbidities. In addition, this study attempting to answer the question, do depression screening apps motivate at-risk depression individuals to seek professional help? This is a cross-sectional survey study. A free smartphone depression app, Depression Monitor, was developed in the English language utilizing the Health Monitor app template by shproject.net and released in Apple's App Store globally. After submitting the demographics and baseline data on the first screen of the app, including previous depression diagnosis and treatment and the Charleston Comorbidity Index, the app users will be able to complete the PHQ-9 questionnaire on the second screen and can save the history of their results on their devices. If the participant's depression score is high, they will be advised to take their results to their healthcare professional for further assessment and provided with explanation for their results and links to depression information websites. The app was built with reminder function to remind participants who download the app to fill the questionnaire. All questionnaires data was recorded in the online research database. Consumers at the Apple App Store aged 18 and above were recruited passively over 4 months. The number of app downloads after 4 months was 442. Of these, 279, 63.1%, were from Singapore, with 54.4% response rate, and 36.8% were from New Zealand, with 81.6% response rate. The mean age was 29. 84.2% of users were not previously diagnosed with depression. The prevalence of participants with higher risk of depression in the sample for those who were not previously diagnosed with depression were 60.4% at PHQ-9 cutoff 11 and 45.4% at cutoff 15. There is a significant difference between New Zealand and Singapore in positive depression in our study in cutoff 11 and cutoff 15, and also in other health risks. About 62% of participants with higher probability of depression at cutoff 15 from New Zealand have answered nearly every day to the suicidal ideation statement that indicates a significant suicidal potential compared to 53% from Singapore. In terms of mental comorbidities, 9% of participants with higher risk of depression at cutoff 15 from New Zealand have reported risky illicit substance use and 22% risky alcohol consumption, compared to 0% and 9% respectively in Singapore. 77% of participants with higher risk of depression at cutoff 15 from New Zealand have moderate or high anxiety, and 67% in Singapore. In terms of physical comorbidities, 14% of participants with higher risk of depression at cutoff 15 from Singapore have at least one physical comorbidity, and 23% in New Zealand. This study has provided an evidence of the ability of smartphone depression screening app to reach people who were at high risk of depression, suicide risk, and with various mental and physical comorbidities.